Covering the community, events, and people of Georgia, Carolina. This is the Means Report. Here is Brad Means.
Well, hello everybody and welcome to the Means Report. So happy that you're spending this beautiful summer day with us down at Television Park. And you know we have to begin the broadcast by wishing all of our dads the happiest of Father's Day. I hope that everybody is having a wonderful day. I hope that loved ones, you're treating your dads nicely. You placed those phone calls or you plan to before the day is done, and that everything is happy in y'all's world. We're glad you're back with us, especially after last week taking a bit of a break, as we sometimes do during the summertime. But we have made up for it during this edition of the Means Report with a lot of information for you. First part of it is going to be, appropriately enough, pretty dad specific. We're going to talk about urological issues. Don't change the channel. We're not going to give you a medical lesson here. We're just going to talk about a few key things that men you need to be aware of. We're also going to talk about a great event that's coming up where you'll get a wonderful meal and you'll get to learn even more about issues facing men as we wrap up Men's Health Month here during the month of June. So just stick around for that. We have an expert here who's going to make it all very clear to us. A little bit later in the broadcast, we're going to talk about some up-and-coming talent from here in our area. They're on the Lady Antebellum stage these days, but check that they're not on the Lady Antebellum stage. Forgive me. They will be on the Lady Antebellum stage one day, and then from there, the sky's the limit. These are rising stars, to be sure, and they are just taking their first baby steps now. You can check those out and make a fun Friday night of it throughout the course of the summer in Columbia County. We'll let you know about that. And we'll wrap it up with financial advice from Jeff Fairman, not taking the summer off, making sure that your portfolio stays on track all the time. Let's begin, though, with Men's Health Month and a great event coming up at Doctors Hospital in really about 10 days or so. Joining us now to talk about is Dr. Prakash Maniam. He's a board certified urologist at a Doctors Hospital. And Dr. Maniam, thank you so much for taking time out of your busy schedule to be with us.
Good to be here.
I want to talk about your seminar, first of all. It's coming up on Tuesday, June 26th.
Right.
And you're going to talk about issues that all men should be concerned about. It's 5:30 until 7 o'clock at night. We're going to put the information on the screen in a minute. That's not a lot of time. What highlights are you going to be hitting that night on June 26th at your seminar?
Right, a lot of what we're going to be hitting on is prevention. Not necessarily waiting for something to happen, but things that we can do that are easy, places where you can go that's accessible, where you can screen for diseases that can save a lot of problems, expense, and pain down the road.
Do most of the problems that you see in your practice stem from men ignoring them?
Most of them do. Of course, there are some that that we just can't do anything about. But the majority of the problems and the ones that we're going to be focusing on are things that we can learn about, educate ourselves on to prevent rather than wait for them to happen.
Let's talk about the biggie, first of all, prostate cancer. How simple is it to test for prostate cancer? I don't think we can mention this enough. And how long does it take?
It's very quick, and it doesn't involve a lot of pain, surprisingly. It's as simple as a blood test and a finger exam of the prostate. And that can be done in a matter of minutes. And it's usually done in the doctor's office on a routine visit.
Do you have to wait a long time for the results?
No, the results are usually back either the same day or the very next day.
All right, let's talk about another big issue that's mentioned a lot. That's frequent urination for men. You see it in the ads for prostate prescriptions.
Right.
What kind of problems might frequent urination indicate, and how frequent is frequent before you have to start worrying about it?
Well, in general, if we consider it a problem if you or the patient considers it a problem. Mm-hmm. As far as what can cause it, it can be as simple as behavior, such as drinking more fluid than you realize you're drinking, or it can be something as serious as some types of cancer. It can cause frequency and urgency, or infection, or something more serious like that.
Kind of in the same category as frequent urination is the urge to go but not being able to go. Is that correct?
Correct.
That also may indicate a problem.
That can indicate a problem too. And urgency and frequency often go hand in hand. The biggest thing that we are concerned with as urologists is blood in the urine. Mm-hmm. If that comes in association with those symptoms, then obviously that makes it more urgent.
How old does a man have to be before he starts worrying about these things, especially when we're talking about prostate screenings and some of the symptoms that we've been talking about thus far, is there a key age where you need to say, okay, time to worry?
Well, we start screening at age 50 for most men, although men who are African American or have a family history of prostate cancer should start their screening earlier. That said, if a man has symptoms of urination that's bothersome to him, then he should bring it up to his physician and let the physician decide if it's something to be concerned about.
If you find it early, does that help? It seems, especially with prostate cancer, that you have so many great options if only it's caught early. Is that true?
Yeah, prostate cancer is very much like other cancers in that if it's caught early, all the treatment options are open, and fortunately in prostate cancer there are many treatment options. But I think the physician and the patient need to discuss which would be the best treatment options for that particular patient.
I want to talk about a common child's issue in a moment, but before we move on to the children, let's finish with the adults and talk about another thing that is mentioned all the time, erectile dysfunction. And I'll start with age again. How old should a man be before he realizes this is something I need to go to the doctor about? You talk about a tough thing to go to the doctor about. You talk about the reason we avoid y'all. It's issues like that. What age should we look at there?
Well, erectile dysfunction usually affects men as they get into the 50s, although there are some causes of erectile dysfunction that can occur at much younger ages. They are approached a little bit differently, treated differently, but again, if it's a problem that is concerning to the patient, they should bring it up, and if it's an issue for the patient, then it should be an issue that concerns the physician.
Talk about what are some issues that could contribute to it other than age?
Some medications will affect it, and some chronic diseases like high blood pressure or high cholesterol and diabetes can affect it as well.
We talked about how simple it is to treat prostate cancer. Talk about erectile dysfunction, ED. For men out there who are hearing what you're saying, considering paying you or another urologist a visit, what are the options out there if that is in fact the diagnosis?
The options are many. There are ranges simple as oral medications or things that are more invasive. What we try to do is start as a first-line treatment, start with the oral medications first, and in the majority of cases those are successful, and those are all a person would need.
What about children's issues? We hear so many times about urological issues affecting grown-ups, but what about kids? Do you get patients for bedwetting, and what are some things you could talk to parents about regarding bedwetting and young people?
Right. Bedwetting has a number of causes. Some of them can be behavioral in some kids. If there's a change in the home environment or social environment or school environment for a child, that can affect his or her behavior and thereby his wetting the bed. Most kids are toilet trained at the age of 2 to 3 and maintain their control. But some kids can lose control at night even up to age 5 or even 7. Beyond that, they should seek the help of a physician, but up until that age, that could be just normal or just a social factor.
What can physicians do? Because we parents so many times do want to just wait it out.
Right. There are, again, different options. There are some behavioral therapy options. There are medications that can be given, but we try to avoid those and treat it with just something non-medical like behavioral therapy, watching fluid intake, or maybe as something simple like a bedwetting alarm, which doesn't require medications but can be very effective.
Doctor, what would you say to men who are hesitant, who do have that fear of the white coat and who just don't want to go to the doctor because no news is good news? Do you have cases where men have come in after long absences and then walked away from your office relieved that they finally got over their fear? Yeah,
I think most people have that initial fear, but I think if you can, I think a good family support helps. And I would advise men who are in that situation to bring their spouse or bring a brother or sister or family member and have a support group with them. And whether it's good news or bad news, it's good to have that support with them.
That's wonderful advice for sure. All right, the seminar is coming up on Tuesday, June 26th. I know you've reached a lot of people today, and I know that a lot of you want to find out more from Dr. Maniam. 10 questions for urologists is the topic of Doctors Hospital's big event. It's coming up from 5:30 until 7:30 on the 26th in Classroom 1 at Doctors. And if you want to register, just call 706-651-4343. Do it now. You talk about a nice Father's Day gift. Take a moment to write that telephone number down, 706-651-4343, and then follow Dr. Maniam's advice. Go to the event with your husband or your dad or your boyfriend or just your male person in your life, if you will, and then let that support group be there from the get-go. Dr. Maniam, your information that you've given us has been great. You are a nice, easygoing person. People should not fear you. And
I would hope not.
I would hope not, too. And hopefully they'll get over it if they are and come see you or their urologist. But thanks again for your time. I appreciate it.
Thank you for having me, Brad.
All right, Dr. Prakash Maniam from Doctors Hospital. Go see him. When we come back, we're going to talk about Columbia County's Amateur Series and how it is going and how much fun it is providing on Friday nights in the summer, plus financial advice from Jeff Fairman as the Means Report continues.